You stopped chewing properly. First only on one side, then it became painful and you couldn't chew on the other side either. You have to just swallow your food or chew with your front teeth. They start to wear down, your gums become inflamed, and your jaw joint clicks. At the appointment, you hear everything needs to be removed and implants put in. But what exactly should be put in? How many? And is this really the only solution? This is a typical situation for people who lose their molars and don't do anything about it. You start getting used to chewing without teeth, and that's a direct path to removable dentures. Patients who have lost their molars and can no longer eat properly worry that treatment will be complicated and expensive. Some people put off visiting for years, and as a result, the bone resorbs, neighboring teeth shift, the front teeth wear down, and the situation becomes much more complicated. The main problem isn't that there are no teeth, but that no one has explained to the person what exactly should be done in their specific case. In this video, I will explain what happens when you lose your chewing teeth, what real restoration options exist, and how to choose a solution that will last for decades and allow you to eat again without worrying about having to go back to the dentist. What are chewing teeth? By chewing teeth, we mean the teeth we use to chew, or as patients often call them, molars. These are the teeth that, let's say, are located a bit further back. To put it in a more detailed perspective, our front teeth are meticulously crafted by the natural evolutionary process for the specific tasks of biting and tearing food, while the chewing teeth are specifically meant for the heavy labor of grinding or chewing food thoroughly. That is exactly why these chewing teeth play such a crucial biological role for the health of the whole body, and providing essential structural support, particularly for the front teeth. This is usually what happens. When a patient doesn't have chewing teeth, what starts to take over this function? The front teeth, which are not meant for this purpose. They wear down and chip very quickly. And many patients who lack chewing teeth notice this almost immediately, as they say, right in front of the mirror. Restoring chewing teeth is important precisely because otherwise we will simply lose perfectly healthy front teeth. That's the first reason. The second reason is that the absence of chewing teeth leads to a change in the bite. The bone begins to recede. The bone in the area where teeth are missing simply diminishes. And in the future, even if you want to place implants where the missing chewing teeth were, there will be nowhere to put them, because the conditions won't be suitable. The bone will be very soft and thin. That's why it's important to restore chewing teeth in a timely manner. Another consequence, of course, will be the shifting of antagonist teeth, that is, the teeth that should have been receiving the chewing contact load. As a result, the patient will end up dealing not only with the jaw where teeth are missing, but also with those teeth, or even the jaw, that are located on the completely opposite side. What options are there for restoring chewing teeth? Let's consider a clinical case where we have the front teeth, but all the chewing teeth further back are completely missing. This is also called a terminal defect. With such a terminal defect, it is quite difficult to restore the teeth, and the patient has several options. Option number one, a so-called removable partial denture, can be professionally custom made for your specific needs. This is when we make the chewing teeth directly on the denture and attach this denture to our existing teeth. There are different designs, attachment-based, clasp-based, partial dentures. Some are metal, some are plastic, but we can simply make just the chewing teeth, which will be fixed to our existing front teeth. There are certain rules for this. A partial denture is not always suitable. There needs to be a certain number of your own teeth in the mouth, specifically the front teeth, as I'm talking about now. It is removable, and this solution can be suitable for chewing teeth. What are the pros and cons of a partial denture? One advantage is that a partial denture can be made very quickly. Implantation is not required for this. We cover almost the entire dental arch, so to speak. But there are cases where it is necessary to grind down the neighboring tooth in order to place either a crown with a lock on it or simply a crown, so that the metal clasp, the metal hook, can then be attached to that tooth. So, this is a drawback when it comes to installing clasp-retained removable partial dentures, but such drawbacks do exist. But on the plus side, we can immediately restore all the teeth with this kind of removable denture. I would also add to the drawbacks that this is a removable denture, and it is after all quite a bulky structure, so it will take some time to get used to it. The second type of prosthetics is traditional crowns. That is, we look at which teeth remain and make bridges. In other words, we grind down the neighboring teeth and replace the gap of the missing teeth with a bridge like this, but by grinding down the adjacent teeth. The pros and cons of installing crowns are that we can very quickly restore the dental arch. We grind down the teeth, make the crowns within a week, fix them in place, and the patient leaves with teeth. But the downside, of course, is that we have to grind down the neighboring, completely healthy supporting teeth. Such teeth, once ground down for crowns, will last much less time, and let's say we may lose them more quickly. And the third method is the most modern, advanced, and in my opinion, of course, the most reliable: implantation. That is, as a rule, 2 implants are placed and a bridge is made on them in the same way. But the downside here is that it takes a long time. So first we place the implants, wait for them to integrate, and after 3 to 6 months we make the crowns. Of course, the downside here is the time it takes, but the advantage is that this is a solution that preserves your neighboring teeth. It's reliable, extremely durable, and most importantly, it will look exactly like your natural teeth. No one will ever notice the difference. You can get your treatment plan from several dental clinics at once, without even leaving your home. If you have a 3D scan, you can send it by email to several dental clinics. They will review everything remotely and provide you with an exact treatment plan. This will be your personalized treatment plan, tailored specifically for you, and most importantly with an exact cost. That's exactly how we do it. If you'd like to get a consultation, message us on WhatsApp using the link in the description. Leave comments, like the video, and subscribe to the channel. Take care of yourself and your loved ones. Stay healthy.